Hello everyone and welcome back to our live cast from the PrEP in Europe Summit, and where we continue today is where we actually left off yesterday. This is a feedback from the breakout sessions. There were 8 different groups across the whole audience of the conference, and they were discussing how you can practically implement PrEP across Europe. What are the challenges, what are the good examples, and how can you use these examples in order to spread, to make available PrEP as widely as possible. So right now the rapporteurs from the various breakout groups are on stage already, and you will see them in a second, and they will report back on the basis of their collection of ideas, what they have done, what they have achieved in these groups. And we hope to come to a point where we can combine all of these learnings together into some actionable policy recommendations for Europe, and that's going to be then the continuation of today.
First, I want to say that it was very clear that different contexts are going to use different strategies. Okay? There are some things that are going to work in some contexts, and there are some things that are not going to work. So everything has to be contextualized, you know, in terms of the countries that it is put in. Second, what I'm going to say is that we have more than 3 decades of HIV activism that we can, you know, we need to use those blueprints to be able to, you know, to not forget about that, to use some of that to move forward with the advocacy around PrEP. Third, it's about social networks, and social networks in terms of like peer-to-peer education, you know, just really one-on-one, MSM to MSM, black women to black women, some of those things, networks to really, you know, invigorate and activate the PrEP advocacy at the very ground level, community level. Then the street activism that we need to also build on in terms of advocating for PrEP. We've seen a lot of that in different countries, and we had examples of that yesterday, and then progress it to where we get PrEP information in national health strategies, and then work with, you know, beyond that, work with agencies in country that will help us progress then the advocacy information to UN agencies, WHO, and all of that. So it is from street to national to, you know, to global strategies. And I hope people understand that. Mm-hmm. Making the case for cost effectiveness, we heard that yesterday. You know, how much is it going to cost? How many people need PrEP? And some of those research trials are going on.
Okay.
I'm going to call on one of the people in my group to maybe say anything that they feel is important that I haven't said. There's something about websites that we talked about yesterday around linking those websites to local organizations so we can build momentum, you know, with communities in multiple languages, perhaps, so that we can get connected and continue to advocate for PrEP. I think one of the new things for me that I hadn't heard even yesterday was that in terms of thinking about PrEP, we should think about PrEP in a different form other than pills, where maybe people who are making PrEP can make it into a patch form where people can wear it, like a patch. And I understand through the PrEP pipeline that there are some of those things happening because not everybody is able to take pills. Okay. So,
Winnie, I'm going to have to ask you to wind up.
I hope that's useful.
Okay. I'm asking people to be... Thank you, that's brilliant. I mean, there's some great points. I'm asking people to be concise so we do, if we can, have a little bit of space for questions and answers at the end. Anyway, so Francois, and also, if there's stuff that was your group that was basically sort of, as it were, the points that have already been covered by Winnie's group, don't do those, but do whatever you...
Well, it's difficult just to... But of course, we had many similar things.
Yeah.
But, interesting was we heard about how to map what it is, make some kind of a mapping of the stakeholders involved with PrEP to start with, so we have a clear idea who to engage with all the way around and give them an opportunity to speak out about PrEP and inform them about PrEP as a start point, so it makes it easier then to engage them. Of course, clinical guidelines are very essential, so make sure there are some, even though in some cases there can also be a barrier for PrEP, we heard, but in practice, or normally it would be a help. Starting with key people, this thing we heard also yesterday about like maybe engaging with 1 or 5 doctors and then it begins to spread. We think it's also an experience we have. Understand, of course, the local context, as it was said. Sometimes not mention the LGBT MSM thing too much in the countries where it's not popular. Maybe talk more about prevention in general, HIV prevention, more than saying we want to help LGBT people or MSM. Of course, demonstrate cost effectiveness is key. Start with small project or trials still even though we don't need like that kind of so much evidence anymore. Maybe it's a way of getting the politicians to accept to start at all instead of just starting all at once. Getting a better knowledge of pricing, especially among generics companies, but also Truvada and so, because the transparency is, it's difficult to get a real idea of what's going on in this area, but knowledge of pricing would be a big facilitator. Try to go the European way. Of course, it seems very difficult to go that way, but can we go together in this struggle for better transparency on the pricing? Knowledge of legal systems, because legal status is very difficult to understand. Also document the informal use of PrEP, because of course we use a lot of time to boost the demand, but also it's important to make surveys like Flash PrEP and so to have an idea of how many people are actually using PrEP now, so we have a better knowledge when we go to the politicians to show that it is actually a demand and not something we just think. Social media, of course, to make information available. Facebook groups, there are a lot of. We are talking also that's translating the websites, as it was told, because in some countries it's not allowed to say too much about how to get PrEP. So maybe in the countries where it's allowed, it could be good to make different language solutions there, so that the organizations in different countries can link to this knowledge. Of course, PrEP advocacy with heroes, people like individuals standing up, is a great way, where make these testimonies and grassroots voices. And also advocating with, find the ways, the small ways, like finding some doctors that will be willing to monitor informal PrEP users. It's always somehow possible to find 1 or 2 doctors that are willing to go for ethical reasons, want to go even though it's not totally legal. And at least it was talked about increased testing, HIV testing as a way of promoting, finding finding PrEP candidates, and also a way of promoting PrEP to the users that might need it.
Okay, thanks very much, Francois. That's great. So those were the groups that are dealing with the opportunities. The next 2 groups basically deal with what the barriers are to PrEP, which is just thinking about those barriers. So who's from the yellow group? Diogo.
Okay.
And if you can stick to about 4 points, that would be really helpful.
4 points?
Something like that, yeah.
Okay, I'll try. First of all, it really helped that our group was very diverse. We had people from England, Germany, Italy, Spain, Portugal, Romania, Serbia, France, and Netherlands. And thank you, very well done, sir. It helped because the settings were so diverse and the barriers and the opponents were very diverse. So we decided to tackle this in the journalistic way. So first comes the who, and the who is the opponents. For us, oddly enough, as has been mentioned before, part of the opponents resides in the key populations that are skeptical of PrEP, particularly if they are organized under LGBT organizations, for instance. They can introduce unnecessary noise in the process. Then comes the general population at large, who may be in moral disagreement of their tax-paying money, if it applies, going into this. Then we also thought about, of course, healthcare providers who may still be skeptical, although we found that varied immensely in our different countries. Public health officials may also be opponents, mainly by inaction, not necessarily by actively opposing it. Media coverage in some settings is also very important, and it can also introduce unnecessary noise. Then we have governments and politicians, and we tend to think of them just at a national level, but in many big countries or countries that have divided ways of working, such as Spain, such as the UK, countries that are made up of many different countries, politicians at all levels matter, at city level, at regional level. And finally, religious leaders, which is something we don't think about that often. Then moving on to the barriers, we split them into two groups. One more generic group, and the second one I'll get to in a second. So the more generic is lack of awareness on all of these opponents and on the people that will benefit the most from PrEP. Then comes stigma, shame, and the public perception around PrEP, the moral repression. 1, 2, 3. Aliens want to talk with us. Aliens want PrEP. So, and with that comes misinformation, and comes the problem of healthcare providers some of them having concerns about the effectiveness or the unintended consequences, mainly of disinhibition. Also, this results in a lack of a recognition of PrEP as just a preventive tool. That is a very big barrier in some settings. The lack of normative guidelines does not help in the countries where it does not exist, even though when it does exist, it also is found to not help all that much, because some doctors can just overlook them. And then in a more practical way, the way the drug is dispensed, the supply chain, it can be a very big hassle in many places where people have to go to 1, 2, 3 different places before they get actually the pills in their hands. And finally, in this first group of problems is the poor geographic coverage outside of the main and capital cities. In big countries, this is a problem. In smaller countries, such as the Netherlands, it was also found to be a problem. Finally, and last but certainly not least, we covered specific barriers in reaching trans, migrant sex workers and cis women. These are very different groups, and still we put them in the same bag, even though they shouldn't. I'm almost finished. The main problems here are a lack of involvement and representation, as we can see here in this meeting. I mean, look around. And lack of a voice. This also stems from a poor recognition of their worth to society, of women's worth, of trans people's worth, of migrants' worth to society. So governments cannot face them as a burden. They need to look at them as very beneficial members of the community. And so tailored approaches are needed. Language and communication barriers are very important. There is a very important lack of access to healthcare. And finally, a lack of inclusion in research, as we all know. There's very little research that includes these populations. And that was it. Thank you very much.
I think you said all that without drawing breath. That's great. Thank you very much. And now we do have the Green Group. But I think you've got... who's reporting for Green? Oh, Emmanuel is reporting for Green. Fantastic.
Yeah,
okay,
so we also had the barriers. We tackled what barriers do we have, what common factors are in countries with no PrEP, and what are the opponents. We decided to say targets because we don't really have real opponents. Anyway, as you said, I'll start from the bottom. There's a lack of demand that is created by stigma, by fear of side effects, by lack of information. The 86% number is scaring off a few people. There's also sex workers organizations that are blatantly against PrEP because there's a big stigma against non-condom use. Yeah, the PrEP is still seen as unsafe sex for them. And the message, as we've said again and again, is too white cis MSM focused. We need to get more representation and more targeted messaging. Then there's also sometimes uninformed healthcare providers that don't know they don't know about it, so they don't offer PrEP to people who might benefit for it at the point of care. And there's also a sort of fear of medicalization of prevention. People think, why should we give pills to people who are healthy? But that's actually something we're already doing with statins, but we think of cholesterol as something else, as sex. You know, it's not the same world. Then, of course, some people don't have insurance. The price, that's something we've talked about quite a lot. There are two things. One is the time it costs to get on PrEP. Someone who works full-time until 6 every evening needs to take half a day off or a full day off to go to the clinic, then go again the next week. This takes time. And if they can't go to the doctor to get that testing because the tests are expensive, they need another day to go to the community center, then to the doctor for the prescription. It's too much. So this idea of giving the possibility of starting immediately needs to be really thought about. And then there's also the fact that infrastructures are over capacity, and we're not going to be able to grow new doctors and clinics on trees so quickly. So perhaps we should think about simplifying the protocol as much as possible. Dean Street Express have given us a great example of this. We've seen a great example in Barcelona. I think everybody should look into it and replicate what they've done. Now, common factors. In some countries, unfortunately, politicians seem to not have interest in stopping HIV. They're quite satisfied with the status quo as it is, and they are not aware of the fact that HIV is not just something that happens to a few hundred people that they don't care about. So some politicians need to be made aware of the extent of HIV as it is right now. Then there is the fact that some systems are very complicated and different parts of the system throw the blame on the other parts. They say, it's not our thing to deal with, it's not our problem, ask them. So it's difficult to find the one person in those systems that is to blame. Then we've seen that in the countries that don't have PrEP yet, there is also no clear STI platform. That means PrEP or no PrEP, if you want to get tested every 3 months, it's complicated or it's impossible. We need to grow those platforms so that we just have to add the PrEP onto them. Then also, as you've said, we need a clear statement or research about the needs of key populations, people of color, trans, migrants. We need to hear from them what are the barriers, because we don't really have a clue. Okay, I'll skip directly to the targets. Obviously, heads of organizations that could turn the key at the right moment. And also some specific people in our community, as you've said, who might be making unwanted noise against PrEP. Yeah, ministries of health, media, complicated systems, we've been saying that. It's a bit muddled. The last question, someone at the last moment asked, what would happen if we've sorted out the cost and it was free and available? What would be the next hurdle? And I think it's really the stigma and the infrastructure. Those are the two key things we take out of this session.
Forgot my mic. Brilliant, thank you very much. I'm not doing too bad. This is scheduled to end at 1:45, but I'm not going to end it then, obviously. But you know, if you can be quick, who's next? It's I've lost which colour we're at. Well, it's blue next, isn't it? It's blue. And now we're moving on more to the sort of... oh, wait a minute, you're red, yellow... Yeah.
But
you're doing solutions and strategies. All right, you don't have to stick rigidly to this brief.
Thank you. No, carry on.
Okay, great. So we had a wonderful discussion about the barriers, and also our group was quite diverse because we had people from Western countries and also from Eastern Europe. And of course, we realized that there are so many different barriers, but we agreed that the main key point should be that we should change the way we promote PrEP, and it would be reforming the idea that it's a matter of health and it's a new prevention tool, not to and that we're not going to use condom, but it's going to add the protection, and it's a matter that is related to all the key populations and to any service. So we think that the integration of any service should be one of the solutions, that PrEP should be included in, for example, alcohol services, harm reduction services, migration services, as also offering the choice. I'm sorry about that. The choices, and also it's really important to have a model the needs and the demands as a factor for the cost effectiveness. So at policy level, we should advocate that it will save actually money from the treatment, from the whole treatment cascade. And because you know that most of the times they say, okay, we don't have enough money, it's high cost to offer this widely, and the health benefits of PrEP though, and please, Rosie, help me.
Let me see what else we had. Yes, so then we were asked to think about what the opportunities were, that PrEP brings a whole lot of opportunities, and we balanced between recognizing the diversity of views. There was the idea that some people find it liberating not to have to negotiate condoms, and other people feel as if the floor is being taken away from under their feet to no longer have condoms as the obvious physical barrier. And in that way, we need to recognize the diversity of all the different groups who are involved, including, let's say, sex workers, male sex workers, female sex workers. And instead of just saying, oh, they're stuck with condoms, but why? And how do we, what's the word, in a way respect that view, rather than necessarily just fighting against it as PrEP, Taliban.
Yeah,
exactly. I think that was about, oh yes, and then of course, PrEP, who do we want to be allies with? We want to be allies with everybody. But again, this recognizing the other people have said the small places where you can try and identify in your local population where your small chances are to at least get started with PrEP and get the PrEP conversation started. Fair enough? Fair enough. That's it, is that?
Oh, wonderfully concise. That means we might even have room for some questions at the end. Yep, now we have Purple. Hans Shamal is going to report.
Hi. We also looked at strategies and barriers. Had a really diverse group and a mix of people. They were actually on fire. I got through 3 pens in the whole process. But we looked at the strategies and barriers and what was common between the countries, and we identified that funding, access and availability is a common barrier that can stop an implementation of PrEP, and identified that there's a lack of strategy between reaching those key populations, including refugees, BAME, MSM, women's groups, and trans. We looked at successful strategies, for instance, how NHS England, they were refused fund for a trial, and pressure from community groups and activism from people like Prepster were the driving force for a strategy for provision. For instance, in France, a successful trial, even though small, creates a good case and an obligation to implement PrEP. For our allies, we looked at allies within the group, so health providers, pharmaceutical companies, and finding those allies within women's groups, trans groups, youth groups, people living with HIV, and LGBTQI, and using these allies to educate and inform within their groups and further on. And we also identified the opponents within those groups and how to win them round, looking at the people inside the communities and the lack of education and knowledge of PrEP due to moralistic judgments. That may be stigma, trust, taboo around sexual health. We identified that there are opponents within groups like young gay men, where there's a perception of risk which is low. Peer pressure, and health professionals being sensitive about issues around PrEP and the need for more training around their education. And we identified another opponent, for instance, as the condom Taliban, which was mentioned yesterday, and how PrEP should develop in the future to create it to be more cost-effective and, as a core package, see it as not an addition to HIV prevention. And our 3 questions that we looked at in effective strategies to overcoming barriers, I'm just going to quickly whiz through them, were local, national campaigning, which has been quite successful, grassroots activism, NGOs and associationals, and through media, and that may be social media in saunas, bars, community centres, going and presenting that media out in the groups that need it the most. How do we need to engage our allies? Through church groups, youth services, LGBTI, women's services, including abortion and maternity wards, and community engagement spaces. And our best arguments for implementing PrEP are basic human right, just in addition to sexual reproductive health. PrEP works, as it says here, and it's more cost-effective than treating HIV over a lifetime. Yeah. Thank you.
Doing incredibly well. And finally, projecting ourselves into the future of PrEP, come the pink group. And I think we've got 2 presenters here.
Yeah. Our group was very, very diverse. It's from Eastern Europe and Western Europe. And Eastern Europe was delegated to and empowered to present the key points and supported by Western Europe. It's like an approach. Our question was where we see and how we see the PrEP by 2023. It is important in advocating PrEP to have allies from different fields, like from social media, from policymakers, from NGOs, to be involved, all of them, in implementing and advocating PrEP. The second one was the PrEP to be watched or seen as a holistic approach, like to be a range of interventions, to be introduced like human rights approach, and also promoted as sexual health promotion. The third one was 3 Ps. And the fourth, and here also we wanted to add the 4th P, like pharma companies. Another key point was to involve and empower LGBTI organizations and other key affected populations. Another key point was EU policy or early adopter of PrEP to support, for example, Eastern Europe to implement PrEP in Eastern Europe, and also to introduce PrEP in transitional plan, like Global Fund now is funding HIV prevention programs, but when Global Fund will leave, it should be introduced in transitional plan, the PrEP, what is written and maybe later will be implemented. And another point is reducing stigma towards PrEP, towards LGBTI, towards sex workers, towards IDUs, towards everything. Maybe you can add me, maybe I forgot something.
You were fantastic, obviously. I mean, because we had the future thing, so clearly where we want to be is that every individual is aware of PrEP, they know how to use it, they know what it's used for, and they are able to access it. That's the goal. That's where we're heading. Now, in 5 years' time, we're going to be looking at a much broader range of PrEP options, we hope, we expect. And so also, within that knowledge, we would want people to have choices. So that may be about daily PrEP, it may be about PrEP on demand, but also it might be long-acting injectables, it might be vaginal rings. So there's a whole range of options, and people would be able to choose the option which worked for them, including, of course, that they don't have to use PrEP, they can continue to use condoms, they can continue to rely on monogamous relationships or whatever it is they want. It's also that PrEP needs to be part of full sexual health, because that's one of the main challenges we get as PrEP advocates. You keep on hearing, but what about other STIs? Well, as George said yesterday, HIV is an STI, but let's talk about sexual health. If we want to talk about chlamydia, let's talk about chlamydia. If we want to talk about gonorrhea, let's do that. And let's also not take the focus away from talking about HIV and HIV prevention. Be honest about what it is we're talking about. In terms of BME communities, in terms of LGBT communities, it is part of a human rights approach. It's about equality, and we do not have equality until we have health equality. That's it. Thank you very much.
Okay, brilliant. So we should be on our coffee break, and I don't want to take too much time.
Can I steal 40 seconds?
Into it. Well, what I would rather do is to say I don't want... I mean, is that okay? Do you have any questions or things that you think you need to add to the points that have come up in this incredibly comprehensive review of basically pretty well everything that we've been talking about? But if you'd like to ask a question to one of the facilitators or feel that something has been left out, please do. Now's your chance.
Hi, you beautiful people. Thank you for summing it up. I'm not happy. I think it's not enough to just mention that we need to talk about stigma. I think it's not enough to say that we have to raise awareness. I really would like to leave today and would like to understand what we have to do. Where should we go? For instance, I was just talking to Ferenc now. Should we maybe address it in school programs? I know in Germany we have 2 hours of sex education between the 8th and the 10th class in biology. 2 hours. It's enough to talk about what is a uterus, what is a penis, what is a vagina. So it's not enough. So maybe I would like to go deeper. Thank you.
Thank you very much, Martin. I completely agree with you. Sex education is one thing we haven't looked at. Anybody else? Or are you also desperate for your coffee? Emmanuel, now's your 40 seconds.
Yes, there was another common denominator among countries that don't have PrEP is that STI testing is separated into testing for prevention and testing for treatment. It would be much easier if all that testing would be under one hat. And then secondly, I had a small idea. Perhaps we could, when women go get over-the-counter the day after pill, attach some information about PrEP to it, not because the risk of getting HIV is so high, but because we want the women to be talking about it with themselves, in between themselves. And that's a great place to give them the...
Oh, Mark, where's the other mic? It's in the stand, don't worry. There you are.
It's more of a comment more than anything else, which I raised yesterday and this morning. We're all here representing different countries with all different needs, different legislations, different moral codes, and all that. And I would really love to see international organizations taking on board a common holistic legal framework. Approach the EU, approach people who can actually influence international law to get things moving. All of us can affect national policy. But what happens if a person crosses the border? We've mentioned yesterday the problem of importing drugs from one place to another. In several websites on Facebook, people ask about can I take PrEP from country A to country B? Can I import this drug from country A to country B? But if we get international organizations to come together and go to the EU, for example, and say, this is what we've got, these are the concerns that people have, what can you do as an EU regulatory board, whatever, union, to change things, to get things moving, and make sure that the human rights, the right to health, is also extended to the right to preventative health.
Okay, yes, thank you. I'm going to let Rosalind have a comment, and then I'm afraid I'm going to cut off questions because we all want coffee. The one thing I've heard consistently is, we need to reach the other populations. Well, that's exactly what the next session is all about, where we will be in particular discussing PrEP and women, PrEP and trans people, and PrEP and migrants. So some of the questions that people have been asking will hopefully be answered in the next session.
Thank you. Going on from what Martin said about specific points, in our group and also last night we were talking about PEP. And PEP is something that's accepted everywhere. Of course, it's a good idea. It's based on almost zero research because you can't do the research. You know, you've been exposed, let's see what happens if we don't treat you. That's not, it's not going to fly. But PrEP works, this is a bit technical, almost on the same principle. The HIV virus arrives and you want to block it taking hold in the body. So maybe this is a specific hook that if people feel this is a useful thing to use, that you can remind people that the PEP program did not have almost any barriers to it at all, and that if you can find a way of at least bringing that into the conversation, that sort of makes people think, oh yeah, PEP, we don't complain about PEP. Maybe that's a helpful thought. It's not a guidance, it's just maybe a helpful thought.
Thank you, it's a good point. We also discussed it, and actually Emmanuel said something very interesting. For instance, there are these possibilities for the after pill for women. And what about, for example, launching information with the after pill about PEP?
Brilliant.
Like,
yeah, I think
approach.
That's an interesting idea. Okay, coffee time. I'm only going to give you 10 minutes because I don't want to shave too much into the next session, because I know that it'll be very interesting. There'll be a lot to say. Okay, and don't fall off the stage. Who's that?